California, Oregon, Washington, and Hawaii are breaking away from federal vaccine guidance, issuing their own joint recommendations for COVID-19, flu, and RSV shots. Supporters say it's science over politics. Critics call it a dangerous split. Here's what you need to know.
On Wednesday, the four governors announced a West Coast Health Alliance to provide unified vaccine recommendations ahead of winter. California Governor Gavin Newsom also signed AB 144, a new law allowing California to base vaccine guidance on independent medical organizations rather than the CDC. In a joint statement, the governors said, "Our states are united in putting science, safety, and transparency first, and in protecting families with clear, credible vaccine guidance." The move comes after criticism of the Trump administration's health policies. Federal officials recently replaced the CDC's Vaccine Advisory Committee members with skeptics, a decision public health leaders argue undermines independent, science-based oversight. California's Department of Public Health said the new law ensures recommendations can rely on groups like the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists. The coordinated guidelines emphasize COVID-19, flu, and RSV vaccines. They prioritize older adults, people with chronic conditions, pregnant people, children under 5, and those in long-term care. Doctors say the recommendations also account for households with vulnerable members, like families living with an immunocompromised person, a scenario some say federal guidance overlooks. Pediatrician Dr. Eric Ball told SFGate the alliance provides clarity in a confusing time. "It's nice to have a unified message from these states based on trusted sources." Dr. Peter Chin Hong of UCSF called it refreshing, saying the streamlined approach helps ensure high-risk groups don't fall through the cracks. Oregon's Dr. Sejal Hathi described vaccines as a critical tool to prevent severe illness and death. But questions remain about access. Children on the federally funded Vaccines for Children program may face barriers if state and federal rules diverge. Critics warn this could create a two-tiered system where some families have easier access than others. Politically, the alliance highlights a widening rift between federal health policy and blue state leadership. Newsom's office framed the law as rejecting what it called corrupted federal guidelines. Supporters say the alliance restores public trust by insulating decisions from politics. Detractors argue the split risks confusion and undermines national public health unity. Together, the four states represent nearly 20% of the U.S. population. Their joint stance could pressure other states to follow, or deepen divisions over public health. Experts note that Newsom's signature makes these guidelines enforceable in California, giving the alliance legal weight beyond symbolism.
As winter viruses return, millions of West Coast residents will now follow state-based vaccine rules rather than federal ones. The big question, will this model spread nationwide or widen the gap in how Americans get public health guidance?